Hi everybody, my name is Abby Lee. I'm the Director of Marketing and Business Development here at Bay Area Regional Medical Center. I am so excited. We are back live here on the Women's Center, and today I have Dr. Maximos. I know you all have so many questions, so if you have some questions, comment below. I am so excited to be live with you. Seriously, so for those of you who don't know, Dr. Maximos delivered the very first baby here at Bay Area Regional. Can we get some likes and loves? That is amazing. So we're just gonna dive right in if that's okay.
Sure. Yeah,
so
let's
talk to me about your first baby and why you love it.
It was an amazing experience to be part of history and, a new hospital, new labor and delivery, very first baby. I think 20 years from now, I remember that day and say, well, that hospital, I delivered the first baby there. Also, the experience was great. The way this labor and delivery is set and everything about it is with the family in focus and the mom in focus. I felt that the nurses and administration went 10 steps out of their way to make the mom comfortable and make him feel that this is going to be something different. It's not just come in, have your baby and leave. This is welcome here. We'd love to have you expand your family with us. We want you to feel that, this is your home away from home until you go back with your baby home and feel that you didn't really miss out on much. The place is very home-like. The place is very friendly. It's set up with state-of-the-art equipment. The colors are very soothing and relaxing. So it was a great experience. I think I'll always remember that as one of the best experiences in my life.
So on top of that, why did you want to have the first baby here? Why do you choose to deliver at Bay Area Regional?
Well, I think the Bay Area Regional is going to be one of the top choices for moms because of not just the equipment, our state-of-the-art, the place is beautiful. They're putting a lot of emphasis on care, and we see that in the hand-picked nurses they hired to be part of this place with multiple years of experience and certifications, that you're going to feel that you're in good hands, that you're well taken care of, that you have people that really know what they're doing, and they're going to take every effort possible to make your experience amazing. So I wanted to be part of that. We wanted to give our patients the chance to be here and to be able to deliver here, to have that amazing experience.
Yeah, I can tell you firsthand experience with my son. Having experienced nurses was a game changer. It really was.
Absolutely.
I was so thankful to have super experienced nurses with me by my side.
And most of my patients that I speak to, the nurse makes or breaks the delivery and makes them feel very comfortable, or sometimes, unfortunately, they can feel a little rushed or feel that their needs are not addressed. For the most part, all nurses provide great care, but I think here, just because it's a newer place and it's also a smaller place in a way, that emphasis is going to be a lot more. That okay, your mom can take her time, can have her great experience. We don't need to, we don't need the bed. We don't need to get you in and out as fast as possible to make room for another patient. I think that's going to be the great difference between this place and other places.
So talk to me about the difference in equipment that you really like to use here.
So one of the things that I love about being here is they have these wireless monitors that the mom can be free to move around. She's not hooked up to any wall or equipment that restrict her movement, that she's laying in bed, she can't move around. So the mom can be monitored, and we can reassure the fetus is appropriately watched, make sure the baby is healthy. But in the meantime, she can sit on a birthing ball, she can walk around the delivery suite or walk around the hallways. Whatever will make her experience better, she's able to do that because she has the freedom to do it. The other part of it is the way the room is set up. It's set up as a nice, I would say, bedroom style, that everything is hitting, most of the equipment is hitting. So you look around, you see just walls, furniture, cabinets, but you don't see bulky equipment or anything scary. All the lights for the deliveries are hitting in the ceiling. So it's as if you just staying home away from home in a way until you have your baby. The beds are amazingly comfortable. I don't know.
You tried to lay in one or something like that? What was that about?
I almost fell asleep in like two minutes. because I think the mattresses are very nice. They're not the thin little hospital mats that we usually get, and they move in 20 different directions that the mom can find, I'm sure, a perfect, comfortable position, because some of the labor process takes a long time. So if you're laying in a very uncomfortable bed, that can make it a lot worse for you. So they made sure they have very comfortable beds. They move in different positions. Also, with the epidurals, it's very hard sometimes to move the mom or position her. But with these newer beds, that they allow us to position the mom, or she can position herself a lot easier by letting the bed do the movement for her.
That is, I did not have that when I had my baby. That is so cool. And the wireless monitoring. So that sounds amazing. I was kind of stuck in one place.
I mean, technology is catching up with hospitals as well, and things that make things more comfortable are becoming part of the hospitals, and everyone is looking for that, comfortable bed and comfortable setting to be in.
Okay, and so if you're just tuning in, you guys, we are live with Dr. Maximos here in the Women's Center at Bay Area Regional. In a minute, we're going to show you the rest of this room. There's a little seat over here that turns into a bed, like a really big bed. There's a glider, and there's all of these cabinets that hide all of the equipment and supplies that are needed during delivery, which is pretty amazing. And if you are expecting, we would love to hear when you're due. So comment below if you're expecting and let us know if you're due. And if you're wanting to have a baby, you can shoot that in the comments below, because I'll go back and comment below, because I want to have another baby and I'm trying to convince my husband of that. So we'll see if I'll be visiting you soon. All right, so let's transition a little bit and talk to me a little bit about your history and about yourself and how long you've been in the area.
I've been in the area for 10 years now. I came in 2007, started my own practice in Lake City, and I've been there since then. The city has grown a lot since then, and we've grown with it. We're 3 practitioners in my practice right now, and I'm pretty sure some of the audience recognize the name. We're located in Egret Bay in Lake City. I have been practicing OB and GYN. We do a lot of deliveries, and we take care of low-risk and high-risk moms. We also do a lot of gynecological care, whether it's wellness care, screenings, or surgery. We do a lot of laparoscopic surgeries, minimally invasive surgeries. We do laparoscopic hysterectomies, and most of our procedures now are same-day surgeries that we can get the patient to go home the same day, and recovery is a week or less in some cases.
Oh, that's awesome.
So medicine has come a long way, and we try to keep up with the latest and greatest, and facilities like Bay Area allow us to do that by having the most technologically advanced equipment in the operating room and labor and delivery. So our patients can expect to get the most recent advances in medicine and the best care possible that we can provide for them.
Okay, so you've been in this area for 10 years.
Correct.
How many babies do you think that you delivered in 10 years?
Wow.
Sorry, if you don't know, that's okay, but like roundabout, how many do you think that you've delivered?
I would say maybe 6,000 or more.
Oh my goodness. Yeah, we're starting to get some comments. You delivered several of her friends' babies. So there you go. You are well known in this area. That's very cool. If you guys have any questions below, questions or comments, y'all shoot them below or give us some likes and loves. So I wanted to transition and talk about prenatal care and why is it so important, and what would you tell someone who is just thinking about getting pregnant and they're just starting on this journey of adding to their family? What would you tell them?
Well, we tell them as soon as you find out you're pregnant, please come see us. If you still planning to get pregnant, definitely even come see us before you do get pregnant, because some of the technological advances in medicine is in genetic testing, and now we're able to test the mom and the dad and see if there's anything that we need to be aware of to prevent miscarriages or make sure we have a healthy conception. We initiate vitamins and other therapies before we are able to make sure the mom is in the healthiest form possible. Test for diabetes, hypertension, other family illnesses that could be present in the mom that she might not know about. So definitely come see us for a preconception visit. We can discuss all these things and do the appropriate testing, initiate the vitamins and whatever is needed. Once you get pregnant, we also would like to confirm the pregnancy in the right place, make sure we know exactly how far you are, initiate the vitamins, do some of the genetic testing as well. So the sooner someone comes to us, I think the better in terms of the outcomes, in terms of the care they get, and we try to get that baby to be the healthiest the baby can be.
So at what point do you think that a mom who is maybe trying to get pregnant or just found out that she's pregnant, at what point do you start to take the prenatal vitamins?
As soon as possible. I think we usually recommend once you start thinking about having a child or trying to conceive, or once you stop your birth control, go ahead and start taking the vitamins.
Really?
Absolutely.
Oh, okay.
So
news to me.
You better go get some.
Don't tell my husband. I'm kidding.
But you can get any prenatal vitamin. There's a lot of over-the-counter forms in your neighborhood pharmacy or Kroger's or one of the grocery stores. As long as it says prenatal vitamin on it, you're good. Just start taking those, and you should be okay.
Awesome. Well, anything else prenatal-wise that someone should need to know before they come and see you?
Take good care of yourself as a mom. Like I said, we want you to be the healthiest possible. Just a little bit of exercise, a little bit of eating right, managing any health issues you might have, controlling cholesterol, controlling blood pressure or diabetes if you have sugar issues. Definitely try to work on that with your physician or on your own, because it's a lot easier to control these issues before pregnancy than having to try to control it while you're pregnant. Or if you find out you got pregnant, please come see us as soon as possible, and we'll work with you on controlling these issues and getting you as healthy as possible.
Good, and that leads us to the next question. So if someone wanted to make an appointment with you, how do they make an appointment?
Give us a call, look us up online, or give us a call. Our phone number is 832-632-1333, or go to www.maximosobgyn.com, which is www.maximosobgyn.com. You can also look us up on Facebook. All our information is on Facebook. So,
and we'll tag you on there too, so people can find you easily.
Or you can ask for us here at Bay Area Regional.
There you go. And if you would like to, so there's a couple things that I wanted to touch base or talk about before we do our little tour of this room. We have our grand opening celebration. So, we had this little storm called Harvey come through, and a lot of us are still kind of dealing with that. So we had to reschedule our grand opening for the Women's Center. So we've actually already opened and had some babies already, but we wanted to have a celebration. So the celebration is going to be September 27th at 6 o'clock in the grand lobby, and you will be able to take tours, meet the doctors, meet this incredible, amazing, experienced staff that everyone's been talking about, because they are amazing. I've met a lot of them, and they truly are great. So you'll get to meet everyone. You can take a tour, have some light bites, and have a good evening here at the hospital. So if you want more information, go to our Facebook page to find that, and you can see more information there. And there is an announcement overhead, so I am so sorry about that.
I think those tours are also available in the future. So if any mom is considering Bay Area and wants to come and take a look, I'm sure we can arrange for a private tour.
Yes. You can come and take a tour today if you want to. Right. So the phone number is 281-525-7551. You can call and schedule an appointment to come and meet some of the staff and take a tour now, if you don't want to wait until the 27th.
And the staff is really friendly. If you come to the door and tell them, I just want to see the place, they will let you in and they'll show you around, not like other areas that will turn you away. One thing I love about this place too, it's very organized, it's very secure. There's only one entry point, so you can rest assured that only people that you want them to be part of your experience are going to be part of the experience, and if someone is not welcome, they're going to be outside. So the place is built and designed with the family in mind to provide whatever security and comfort to the family that I think a lot of other places are lacking.
That's awesome. Thank you for that.
Sure.
Okay, so are you guys ready to see the rest of this room, or what? I'm gonna pick up the camera
out of the way, then.
to show you guys. So don't mind all of the other stuff right here. Okay, I'm gonna take the phone off of here so we can show you and turn it around. Okay, so here is the bed. And there's where baby goes. Okay, so we have 2 chairs right here and the tripod, so don't mind that. This right here is the chair that pulls out and makes a really, really long bed, which is amazing. Here is the glider. Everyone loves those. Oh, you have some fans on here. Ashley says, I love that. Ashley, you got some love back. This is what Dr. Maximos was talking about, all of the cabinets that hide all of the equipment and the supplies.
The trash is hidden, the linens are hidden, everything is hidden.
Everything is completely
Even the
hidden.
gloves,
Even the gloves,
try
yep.
to hide it.
So I'm gonna go by the door right here so you guys can see how big this room is, and it probably won't do it justice. So here we are coming in,
and then the postpartum
right?
rooms are as big as these rooms, so that's nice. So you can have as much family as you like to celebrate with.
Yeah, I was talking to someone, they said they had several kids in there after they did. So here, let me point out a couple things in here that are pretty spectacular. Do you see that shelf right there? I know, we're looking at a toilet, but if you've delivered before or you're a mom, you know how important that little shelf is right there. And look, take a look at this. A place to sit down in the shower if you'd like to. Isn't that amazing? Oh, I wish I delivered in a place that was this cool. So, all right. Do y'all have any other, is there a bathtub? No, there is not a bathtub. There's just a shower, and there is this little bench that you can put down. Good question, Sandra. Any other questions before we go? If you guys have questions and you're watching this after the fact, we'll be sure to answer any of your questions. Thank you so much, Maximos, for being with us live today.
Sure. Thank you guys for watching, and looking forward to seeing all of you here.
Awesome. Y'all have a great day. Talk to you soon.